Everybody, my name is Gilda Lopez, and I'm here to give you a little bit of background as to why I want to become a PA, the certifications and education a PA needs, and things I have also learned along the course of this class. So what is a physician assistant? As mentioned in aapa.org, PAs are medical professionals who diagnose illness, develop and manage treatment plans, prescribe medications, and often serve as a patient's principal healthcare provider. With thousands of hours of medical training, PAs are versatile and collaborative. I'm sure that we've all gone to the primary care physician's office and we've encountered a PA. We've also gone to a clinic setting, the emergency room, urgent care. So like it mentions, they are versatile, they are collaborative. It says it in the title as well. They assist the physician. So of course they're going to prescribe medications. They work under an attending. So of course, at the end of the day, the attending is the one who reviews everything and they make the final call as well. So school preparation, what does a PA need in order to become one? If they're like me, starts off with a community college, transfer out to a four-year institution, or where you can go and obtain your bachelor's. In this case, I'm obtaining my bachelor's in kinesiology here at CBU. Not every school requires a major in certain things such as far as science. I believe USC is one of them that do require a science major, but it's been a while since I've actually researched. For instance, also USC is a 3-year program versus Western and CBU, who I'm considering to apply for next year. They are a 2-year program. They want you to have a bachelor's, and as long as it's any kind of bachelor's, there's no specific one. But in addition to that, one has to do their science classes. So of course, it would be the general education, any general education, it will be your general chemistry, genetics, psychology, math, microbiology, anatomy and physiology 1 and 2, a certain GPA, and probably 1,000 or 2,000 hours of patient care. Some of them require that it's paid. Some of them is volunteer. It's really about doing your research. And of course, like I mentioned, CBU is a 2-year program, and so is Western. Their main emphasis is primary care physician. USC is a 3-year school for the program. So like I said, every school is completely different. After they graduate, of course, there are certain certifications that a PA must keep current, up to date. They have to apply for the state exam, which is called the Physician Assistant National Certifying Exam. Some people know it as PANCE. Once they also apply for that, then they also get a license where that one is used to prescribe medication such as narcotics, antibiotics, because that does require an additional license in order to have. They also have to have a current CPR. They have to maintain a clean license. A clean license, I mean, as making sure that they have they pay their fees and they pay their continuing education classes, which is, they are known as CMEs, continuing medical examination classes, I believe. And they have to do 50 every 2 years and pay their renewal fee. I know because I work as an LVN and I have to do 30 hours every 2 years, pay my fee. Of course, you can get audited, so always make sure that you have that printout and keep it for your records. The CMEs, they have to do more focused onto whatever specialty you're in, or a primary care setting. So if you're primary care, your cardiac, your neuro, just make sure that you do your continuing education courses in that area. That way, you're keeping most current date. If anything has changed, you make sure you know any changes. I know also as of October 1st of 2018, every PA and every healthcare provider that prescribes any type of narcotic, they have to run it through Cures. And Cures is a system where they can check if any kind of medication, as far as a narcotic, has been prescribed And we just want the reason for it is because there has been a lot of misusage of narcotics. So of course, if they run it and they see that the patient has just received a prescription for somewhere else, then it's gonna cause an alarm for that provider and say, well, you just got a prescription, then you can't do it. And any other certification that may be required if as a PA you don't want to stay in primary care and you want to outsource, there is fellowship programs. For instance, where I work in orthopedics, they do offer a program for orthopedic fellowship. They also offer an emergency room medicine fellowship. For the emergency room is a 1 to 2 year track, and orthopedics is a 1 year or 1 year fellowship program, but they also offer a doctorate program. So it's all about knowing what to do, how you do it, letters of recommendations, make sure you exceed. The reason I want to be a PA is because I like helping people. I want to make a difference, no matter how small it may be. I see it with a lot of patients that I work, from the parents to the older people. They don't always want to ask questions because they feel they're taking the doctor's time. However, I feel that one shouldn't be left with more questions that they came in with. It's always good to understand why things are happening. And when I see that, it just breaks my heart. I want to do this because I want to make that difference. I want to make sure that the patient leaves not wanting to dread going to the doctors or saying, "Oh my God, I don't know what they even told me," but I want to treat them. Right now, I was leaning more towards orthopedic PA, but since I found out they do offer a fellowship program to the emergency room, I'm kind of considering, but really I won't know until I get accepted into the PA program, start doing my clinicals, and go from there. I'm hoping really, it can really help me find what I really want to do as far as medicine. And this is as close as I'm going to be as a doctor. And of course, I'm going to cherish it and love it. I don't see this as a job. I see this as a passion. So I am just thrilled to hoping to become a PA, to be that awesome healthcare provider that somebody is going to want to recommend and want to see and go from there. Anyway, types of jobs. As mentioned, the focus when they go into school as a PA is the primary care physician office. Then not that there's anything wrong. We always need primary care providers, but there is also specialty. There's urgent care and emergency room, and for when they go into specialty, some of them they will also even go into the operating room. They'll be the second assistant to the doctor. Once the surgeon is done, they'll just say, "Oh, here you go. Can you suture? That way I can go on to the next one." But everyone is completely different. But to know that they're also in the operating room is it's pretty awesome. Be helping a person heal or get rid of an infection. That's just amazing. Um, Also, I found out that, of course, the PA world is growing. And according to the United States Bureau of Labor Statistics, the job outlook in PA is that it's projected to grow 37% from 2016 to 2026 because of a demand for health services is growing. So, of course, there's always going to be um, new innovative ways of helping people and finding ways of treating them, but having a hands-on, it's never going to change. And I feel that just being this close to medicine is amazing for me. I've had encounters where I just dread going to the doctors, but then I've also had encounters where they're just fascinating. And being as a nurse, I see the behind the scenes. I get to see how the doctors are, how they truly care. At least in the field that I'm in, I see the doctors, how passionate they are with their patients. I even work with an 84-year-old doctor. So just knowing that I can find my calling, it's just amazing. So I'm hoping you learned a little bit of why I want to become a PA and the types of jobs that I'll be looking into.